Have you ever started a new medication and noticed things felt a little different in the bedroom? It's a topic many people feel shy about, but it's incredibly common. Your sexual health is an important part of your overall well-being, and when a medicine meant to help you starts causing problems in that area, it can be really frustrating and confusing. You might notice a lower desire, difficulty getting aroused, or trouble reaching orgasm. These are all potential sexual side effects of various medications. The good news is you're not alone, and there are many ways to manage this. The first and most crucial step is understanding what's happening and knowing that it's okay to talk about it. Remember, the goal is to find a balance where your health condition is managed effectively without sacrificing your quality of life, including your sexual satisfaction. Let's explore how to navigate this challenge together. Many types of medications can interfere with your sexual function. Antidepressants, particularly selective serotonin reuptake inhibitors, or SSRIs, are well known for this. They work by increasing serotonin levels in the brain to improve mood, but that same chemical can also dampen libido and other aspects of sexual response. It's a common trade-off that doctors and patients often have to weigh. Blood pressure medications, like beta blockers and diuretics, can also be a factor. They can sometimes reduce blood flow throughout the body, including to the sexual organs, which is essential for arousal. Other medications, such as certain antihistamines, hormonal contraceptives, and even some over-the-counter remedies, can have an impact. The mechanism varies, but the result can be a noticeable change in your sexual life. It's important to understand that these side effects don't happen to everyone who takes a particular drug. Your body's chemistry is unique, and how you react can be very different from someone else. The number of people affected varies widely depending on the specific medication. For some drugs, a small percentage of users report issues, while for others, the number can be significantly higher. Scientific research has consistently documented these effects. A study published in the Journal of Clinical Psychiatry, for example, REVIEWE, multiple trials and found that sexual dysfunction is a frequent side effect of many psychotropic medications affecting desire, arousal, and orgasm. This isn't just anecdotal. It's a recognized pharmacological reality. The challenge is that these medications are often essential for treating serious health conditions, so simply stopping them isn't an option. This is why open communication with your healthcare provider is so vital. They need the full picture to help you find the best solution for your health and your happiness. So, what can you do if you suspect your medication is affecting your sex life? The absolute first step is to talk to your doctor. Do not, under any circumstances, stop taking your prescribed medication on your own. Abruptly stopping can lead to withdrawal symptoms or a return of the health issue you are treating, which can be dangerous. Schedule an appointment specifically to discuss this side effect. It can feel awkward, but remember, your doctor has heard it all before. This is a medical issue, just like any other side effect. Before your appointment, it's helpful to get organized. Keep a simple journal for a week or two, noting the specific issues you're experiencing and when they started in relation to your medication. Are you having trouble with desire, arousal, orgasm? Be as specific as you can. This information will give your doctor a clearer picture of what's happening. When you talk to them, be direct. You can say something like, "I started this new medication about a month ago, and since then, I've noticed some changes in my sexual function. I'd like to talk about what we can do." Your doctor needs this feedback to help you. They can't address a problem they don't know exists, and they want you to feel good on the treatment they've prescribed. Once you've had that initial conversation, your doctor will likely discuss several potential strategies with you. One of the most common approaches is a wait-and-see period. Sometimes, sexual side effects can be temporary. Your body might just need some time to adjust to the new medication, and the issues may lessen or disappear on their own after a few weeks or months. If the side effects persist and are bothersome, Another option is adjusting the dosage. Your doctor might be able to lower your dose to a level that still effectively treats your condition, but reduces the unwanted side effects. This requires careful monitoring to ensure your primary health issue remains under control. It's a delicate balancing act that must be managed by a professional. Another strategy is changing the timing of your dose. For some medications, taking it after you've had sex for the day, such as right before bed, can help minimize its impact on sexual activity. This isn't effective for all drugs, especially those that build up in your system over a long period, but it's worth discussing with your doctor as a potential option. If those adjustments don't work, your doctor might suggest switching to a different medication altogether. For almost every condition, there are multiple classes of drugs that work in different ways. For example, if an SSRI is causing problems, your doctor might recommend a different type of antidepressant, like bupropion, which has a lower incidence of sexual side effects. Some studies, including a review in the journal Innovations in Clinical Neuroscience, highlight that certain medications are specifically chosen for their more favorable sexual side effect profile. This process might take some trial and error. It can be frustrating to try a new medication, wait to see how it works, and then potentially have to switch again, but finding the right fit is worth the effort. There are also options for drug holidays, but this must be strictly supervised by your doctor. This involves skipping your medication for a day or two, perhaps over a weekend, to allow for sexual activity. This is only safe for certain medications and certain health conditions. Never, ever try this without your doctor's explicit approval and guidance, as it can be very risky. Beyond medication adjustments, there are many lifestyle and behavioral strategies that can make a huge difference. Focusing on your overall health can have a positive ripple effect on your sexual well-being. Regular exercise is fantastic for both mental and physical health. It improves blood flow, boosts mood through the release of endorphins, and can increase self-confidence and body image, all of which contribute to a healthier libido. Managing stress is also key. High stress levels produce cortisol, a hormone that can suppress your sex drive. Incorporating stress reduction techniques like mindfulness, meditation, yoga, or even just spending time in nature can be very effective. Make sure you're getting enough quality sleep. Sleep deprivation impacts hormone levels, including testosterone, which is important for sex drive in all genders. Aim for 7 to 9 hours of restful sleep per night. Your diet matters too. A balanced diet rich in fruits, vegetables, and whole grains supports overall cardiovascular health, which is directly linked to sexual function because it relies on good blood flow. Don't underestimate the power of connection with your partner. Sometimes the pressure to perform when you're already worried about side effects can create a cycle of anxiety. Talk openly with your partner about what you're experiencing. Explaining that it's a medication side effect, not a lack of attraction to them, can relieve a huge amount of pressure on you both. Focus on new forms of intimacy that aren't solely centered on intercourse. Spend more time on foreplay, explore sensual massage, or simply cuddle and talk. Reconnecting emotionally can often help rekindle physical desire. Scheduling time for intimacy can also be helpful. While it might not sound spontaneous, it can take the pressure off and ensure you're connecting physically when you both have the time and energy, rather than waiting for a spontaneous desire that might be dampened by medication. Consider seeking professional support. A therapist or counselor, especially one specializing in sexual health, can provide a safe space to discuss your feelings and develop coping strategies. Couples counseling can also be incredibly beneficial, helping you and your partner navigate this challenge as a team and improve your communication and intimacy. Remember, you have options, and you are in control of your health journey. It's about working collaboratively with your doctor, and if you have one, your partner. By being proactive, open, and patient, you can find a solution that allows you to manage your health condition effectively while also enjoying a fulfilling and satisfying sex life. We hope this gives you a clear and empowered path forward. Taking care of your sexual health is a vital part of taking care of yourself. For more reliable information and resources on all things sexual health, be sure to subscribe and follow our channel, Sex Education Repo.